COVID-19 vaccines, boosters, and now the oral COVID-19 pill. Welcome back to the Snapshot Channel. My name is Mia, and you are probably here because you are confused about which vaccine is better. Booster shots, the side effects, efficiency, and so on. US drug company Merck announced the success of an oral pill to treat COVID-19 recently. We will talk a little bit more about that later, but first make sure you like and subscribe to our channel if you like our videos. Also, remember to click that bell button so you get notified when we upload a new video. That's right. Alright, now vaccines first. There has been information left, right and center about the different brands of vaccines that are now available in Australia. So we have collected all the information you need in a snapshot from medical experts around the world for you to make an informed choice. Not long ago, we did do a video comparing Pfizer, AstraZeneca and Moderna. You can find the link to that video just below. At that time, Moderna was not yet available despite being given provisional approval by the Therapeutic Goods Administration, but now you can get a Moderna jab at your local pharmacy. And soon, towards the end of the year, the US-made Novavax will also be available in Australia. So, how does each vaccine work? Both Pfizer and Moderna are mRNA vaccines that do not contain any weakened viral loads and is simply a man-made genetic code that instructs the body to make spike proteins. You know those spikes that you see in the pictures of the COVID-19 virus? Well, these proteins then stimulate an immune response. But Moderna contains 100 micrograms of vaccine compared to a Pfizer, which only has 30 micrograms. Efficiency for each vaccine continues to change as more people get their jabs, and scientists can learn more about how the vaccines work in the real world. We now also have more data about how effective these vaccines are after 5 to 6 months. The latest information shows Pfizer's efficiency is around 95%. For the Delta variant, it is about 88%. After 6 months, there is a huge drop to 80 to 84% and will continue to drop at 22% every 30 days. However, the efficiency against being hospitalized was still quite high at 88 to 93%. Recent studies show Moderna prompts a stronger immune response than Pfizer, and it is more long-lasting. Moderna's efficiency at preventing infection is also at 95% for the Delta variant. It is a bit lower at 76% after 6 months. General efficiency remains steady at 93%, suggesting it is slightly superior to Pfizer. Moderna's efficiency against hospitalization is also at 93%. In contrast, AstraZeneca contains an inactive adenovirus, basically a virus that can cause colds and other illnesses. But when inactive, it is perfectly harmless. The adenovirus acts as a shell that carries a genetic code that makes the cells produce that spike protein, triggering an immune response. AstraZeneca's efficiency is around 74% and increases to 84% in people 65 years and older. For the Delta variant, it is at 60%, and after 6 months, efficiency falls to 67%, which is much lower than Pfizer, but it is coming off a lower base. AstraZeneca's efficiency against hospitalization is at 77%. Now, Novavax works differently to all of the above. It is like a traditional vaccine, and it contains a protein adjuvant, which is something that strengthens an immune response together with a small part of a weakened version of the coronavirus spike protein. With Novavax, there isn't as much data because it hasn't been used that much around the world due to production issues. According to the trial data, Novavax efficiency is around 93%. But if any further credible data comes out for Novavax, we will let you know. So definitely stay tuned to our channel and make sure you subscribe. If you're worried about these vaccines containing genetic codes, experts tell us these do not change or interact with a person's DNA. Since our last video about the vaccines, a lot has changed in Australia. Both Pfizer and Moderna are now available for people between the ages of 12 to 15 as well as over the ages of 60. Previously, those of you who are over the age of 60 can only take AstraZeneca. So now if you are in this older age bracket and a bit hesitant about AstraZeneca and its possible blood clotting, Pfizer and Moderna have just opened up for you. Novavax is currently being tested for adults from 18 to 84 years old of age, so it will most likely be approved for those over 18 only. Side effects. In terms of side effects, Moderna and Pfizer are quite similar in that both has or very rare risk of heart muscle inflammation and other side effects such as fever, headaches, pains, tiredness, and or redness and swelling at the injection site. AstraZeneca has similar side effects to Moderna and Pfizer, but also includes a rare blood clotting condition. Novavax is said to have substantially less side effects compared to the mRNA vaccines in their phase 3 trials, with only about 40% of the people who received Novavax reported fatigue after the second dose, as compared with 65% for Moderna and more than 55% for Pfizer. Booster shots. Now on to booster shots. As the efficiency of vaccines wear off over time, there has been a lot of discussion in the UK and US about booster shots because they're quite ahead of Australia in terms of vaccinations. Latest data coming from Israel, which is the country leading the third booster shot, shows that 2 weeks after more than 1.1 million over 60-year-olds had received their third dose, they were 11.3 times less likely to become infected with Delta. However, there are a few considerations. If you are vaccinated and you get infected, you probably won't get too sick and your body will generate natural antibodies just like a booster shot. However, there is still not enough data right now to show how sick a vaccinated person can get every time they become infected in the future. Because even if the protection from the vaccine wears off over time, you may also continue to generate enough antibodies needed to fight off the virus. So if hospitalization rates do not go up as more vaccinated people become infected in the future, then booster shots are probably not needed. The other consideration is the shortage of vaccines worldwide. It means if first world countries use up the vaccines for the booster shots, those in the third world countries who have not even received their first vaccine will miss out. So here in Australia, Health Minister Greg Hunt suggested it is likely we will be doing a booster shot 12 months after a person's initial vaccination. Elsewhere, it is 5 months in Israel and 8 months in the US. Whilst you need to have the same vaccine for the first 2 shots, you don't need to stick with the same brand for the booster. In fact, some studies in Europe suggested if the booster is a different vaccine, it may give higher antibody levels. In Australia, we have secured Pfizer, Moderna, and Novavax for booster shots if needed. AstraZeneca is still testing a variation to its vaccine to see if it can be used as a third booster shot. Now onto the COVID-19 pill. Now this is something exciting. It is the latest breakthrough of an oral COVID-19 pill developed by the drug company Merck. This pill is apparently so effective that it can halve the chances of dying or being hospitalized due to COVID. At this news, Merck's shares went up by 9%, while shares of the vaccine companies dropped by 10%. The pill works by interfering with the virus's ability to copy its genetic code and reproduce itself. But early studies show that the pill did not benefit patients who were already hospitalized with severe disease. And there is no definitive conclusion on the side effects of the pill. There you have it, folks. Welcome to the COVID future, a simple pill that you can take to treat it. If you have any questions about what you have heard today or want more information, make sure you leave your comments below so we can get back to you. If you like this video, please make sure you hit that like button and subscribe for more. See you next time. Bye!